Depression makes the world seem gray or black. You may feel sad or helpless and unable to do anything. If there is one thing you want when you are depressed, it's to draw the curtains and get under the covers. You don't enjoy anything anymore and you are constantly down. Today I am talking about depression, its characteristics, causes, forms, and more. Depression is a medical illness that negatively affects how you feel, the way you think, and how you act. Being depressed, you are constantly tired and don't feel like doing anything. Everyone feels down or tired from time to time. These are normal feelings, which are appropriate for setbacks or problems in life. Often those feelings last a few hours or a few days. But depressed people are unable to discover anything positive anymore. Not in the world as a whole and not in their own life. If someone suffers from this for a long time and can no longer get over the gloom, we can talk about depression. Depression affects many people. 10% of men and 20% of women will develop depression in their lifetime. Depression can occur at any age. It can affect both old and young people. In children and young people, depression can manifest itself as behavioral and learning problems. In the elderly, depression is sometimes confused with dementia. Depression is more common in some families. In these families, there is a greater vulnerability to depression. Genetic factors make a person vulnerable, but this does not necessarily mean that someone will become depressed for sure. Genetic factors play a role in about a third of depressed people. Depression has two main symptoms. The person suffers from depressed mood and loss of interest or pleasure during the same 2 weeks period. In addition, there are a series of other symptoms of depression. A person feels sad nearly every day and loses interest in things he or she once enjoyed. The appetite changes as well as the sleep pattern. People may feel tired every day and experience loss of energy. Other feelings that belong to depression are irritability, inner restlessness, or a dull and empty feeling inside. Sometimes the person does not notice these changes, but others see restlessness or slowness in movements. Depressed people may blame themselves or feel hopeless, worthless, and guilty. They cry a lot or they would like to cry but can't. Old bad memories can suddenly come back, starting to affect their lives. Depressed people also have trouble concentrating. They notice that thinking slows down. Therefore, making decisions is so difficult. They are much more hesitant when making the simplest decisions than before. When they look in the mirror, they see an emotionless expression on their face. A depressed person sometimes thinks that life is meaningless, sometimes thinks about death, and even wants to commit suicide. The person may be afraid of having a serious illness or is very concerned about money. Depression also includes physical symptoms. For example, being tired for no apparent reason or having a heavy feeling in arms and legs. Depressed people have difficulties falling asleep, or they wake up often in the middle of the night or very early and can't fall asleep anymore. Or they sleep too much. About half of the patients feel worse in the morning than in the evening. The opposite also occurs. Most depressed people have poor appetite. They feel like they are not hungry or the food doesn't taste at all. Many patients with depression lose weight when not dieting or weight gain, because some start eating a lot more than usual. In addition, people often suffer from constipation. The sex drive diminishes or disappears completely. But what is the difference between being depressed and feeling blue? Feeling blue or being down in the dumps are ways we describe feelings of sadness and melancholy. True depression has a series of other symptoms in addition to sadness. We speak of depression when someone has at least 5 symptoms. At least one of these symptoms must be a main symptom. Feeling a bit down usually decreases in a few days, if not hours. Feeling blue, we've all had, is temporary. But true depression can last for months or years without treatment, or it can reoccur frequently. The symptoms of depression range from mild to severe. There are also different types of depression. For example, you can get depression after childbirth, a postpartum or postnatal depression. Dysthymia is a mild variant of depression. With this condition, you have fewer symptoms than when you suffer from regular depression, and the symptoms are less intense. However, this form of depression persists for at least 2 years. Depression can also be part of bipolar disorder or manic depression. People who are bipolar have alternating periods of depression and periods of abnormally elevated or irritable mood. These shifts can last for hours, days, weeks, or months and interrupt the ability to carry out day-to-day tasks. Bipolar disorder usually begins in early adulthood. Another form is seasonal depression, which reappears in the same season every year. For example, an individual may suffer from a winter depression. Depression usually develops gradually. In a minority of people, depression develops faster, sometimes even within a day. Without treatment, depression can go away after an average of 4 to 6 months, but it can also take much longer, even years. With proper treatment, the symptoms can be reduced or the duration of the depression can be shortened. Depression gets worse if you use a lot of alcohol or drugs. Depression can be one-time occurrence, but in about half of the cases, a person becomes depressed again at some point after recovery. Depressive periods can follow one another quickly, but you can also have no complaints for years before a new depression develops. It can also happen that depressive periods alternate with abnormally elevated happiness and high energy levels. This period is called mania, and it may indicate bipolar disorder. Depression is a complex disease. Although there has been a lot of research in this complex area, there is still much we don't know. A single underlying cause for depression has not been found. Usually, there is no single cause. Depression often occurs due to a combination of causes. There are 3 main causes. The first group are biological causes. Unfortunately, many people still think that depression isn't a real disease, but that someone just needs a kick in the ass. But depression is just as real as a broken leg or pneumonia. Depression changes the structure and biochemistry of the brain. Research of families where many depressions occur has shown that the chance of developing depression is partly hereditary. It's often said that depression results from a chemical imbalance. As a result, the substances necessary for the functioning of the nerve cells are out of balance. With antidepressant drugs, this balance can be restored. But certain physical illnesses, such as thyroid disease, can also cause depression. Wrong or too much medication can also cause depression. Depression is often associated with too much alcohol or drugs. To find out if depression has biological causes, a physical exam and blood test is necessary. Psychological causes are about how well you are able to cope with problems and difficult times. We call this ability resilience. It does not mean that people don't experience stress, emotional upheaval, and suffering. It even means that you dare to ask for help from friends or family if necessary. Character traits play a role as well. Personal characteristics such as worrying and perfectionism can influence the development of depression. The effect of prolonged stress on the brain plays an important role in the development of depression. Social causes are major life events such as illness, divorce, death of the loved ones, or unemployment. They increase the risk of depression, just like events that happened long ago, such as emotional neglect or the loss of a parent in your childhood. Positive events can sometimes be very drastic as well, such as the birth of a child. These three causes can separately play a role in the development of depression, but it's often about a combination of factors. For example, someone who has difficulty being alone and who has a family history of depression has a greater chance of developing depression after the loss of a partner than someone who is independent and who has no family history of depression. The depressive feelings can be so strong that they seem to imprison the person. As a result, a person no longer has the energy to seek help and is unable to follow the well-intentioned advice of relatives and friends. He or she may feel very lonely. Depression is a main cause of suicide attempts and suicide. That is why it is vital that depression is recognized and treated in time. In the case of very severe depression, hospitalization is necessary. Next time I will be talking to you about depression treatment. So don't forget to like, subscribe, and turn on the notification bell. Thanks for your attention. Bye.